Hello, this is Sudharshan, and in this episode PH 1.30, we will talk about antiarrhythmic drugs. So, there are four classes of antiarrhythmic drugs: Class 1 sodium channel blockers, Class 2 beta blockers, Class 3 potassium channel blockers, and Class 4 calcium channel blockers, and other antiarrhythmic drugs. So in this lesson we'll talk about part 1, that is class 1 antiarrhythmics, which are sodium channel blockers. The drugs in this class: quinidine, procainamide and disopyramide. And coming to the actions of quinidine, it increases action potential, effective refractory period and QT interval. And with respect to blood pressure, it causes hypotension. And coming to the side effects, it causes very commonly GI disturbances, torsade de pointes, which is the twisting of QT intervals, and hypotension with thrombocytopenia. And a very important side effect or adverse effect of quinidine is synchonism, which presents as deafness, headache, blurring of vision, confusion, delirium, basically CNS depression. And coming to the drug interactions, so quinidine will interact with neuromuscular blockers and other antiarrhythmics like class 2 and class 4 antiarrhythmics. And coming to procainamide, so procainamide is known to have a metabolite, that is NAPA or N-acetyl procainamide. And one extra use of procainamide is used to treat Wolff-Parkinson-White syndrome. And with respect to the side effects of procainamide, the drug-induced lupus is very important, that is SLE. And coming to disopyramide, the side effect of that will be anticholinergic effects, that is atropine-like side effects. All these drugs, quinidine, procainamide and disopyramide, they are class 1A drugs. Next, let us move to class 1B drugs. In this we have lignocaine, mexiletine, then tokenide and phenytoin. And as we know very well, with lignocaine, it is a local anesthetic, very commonly used. And when it comes to the side effects of lignocaine, it will cause CNS, CVS and GI side effects. And very commonly lignocaine interacts with propranolol. And we know that lignocaine commonly used in surgical procedures in combination with adrenaline, which is a vasoconstrictor for bloodless field of surgery. And when it comes to mexiletine, it causes GI side effects. Phenytoin, it is an anti-epileptic, very commonly causes hirsutism. Apart from that, hepatotoxicity, Heidentoin syndrome, gingival hyperplasia, neurotoxicity, microcytic anemia. So this is with class 1B drugs. And coming to class 1C drugs, we have two. One is flecainide and then propafenone. And these drugs don't have much effect on action potential, but 1A and 1B do have. And very important, class 1C is contraindicated post MI, whereas 1A and 1B can be given post MI. And all the class 1 drugs are in fact contraindicated in hyperkalemia, and they are state dependent. That means they are most selective for ischemic tissues. Propafenone is known to cause metallic taste. And yes, so that is all about the class 1 antiarrhythmics. So thank you so much. We'll see you in the next lesson.